start off by considering the minutes from the meeting of June 17th as our first point of discussion. So, Betsy, can you call up the minutes?
I think I certainly can. I can try anyway.
Cheryl doesn't have to worry about it because she wasn't there. But Eileen and I need to say, yes, indeed, those are great, or no, you got to make these changes.
You can see these, right?
Thank you. Eileen, do you have any suggestions for changes?
I did not. I think on the quick perusal I was able to do, I think everything looked relatively okay from what we had discussed. Yes.
I think things are. I had one tiny little point, which is toward the bottom. We get into COVID-19 territory. And probably the third paragraph down, there's it's a one sentence paragraph that says, it's asking how the owner will address this in a COVID-19 way, which is a little bit of a slang. I mean, I think we should be a little more formal and say perhaps we'll address this in a way that reduces the spread of COVID-19. Might be a better way of expressing that.
Oh, that's probably actually what I said, but that's okay.
Right. So if we're good with that, is there a motion to approve as amended?
I motion to approve the minutes from June 17th, 2020 as amended.
I'll second that. All those in favor, please say aye.
Aye.
Aye. All right. So the minutes as amended are approved. After that, back to the agenda. Correspondence review. Well, our correspondence reviewer has left the board. I wonder if there's anything that's worthy of our review.
Not that I'm aware of, but.
Okay. Well, we're coming up on reorganization momentarily, so this will be a pretty good time to bring up the need to assign ourselves some responsibilities. So what we have generally done for the board is to have one of us serve as chair, another one to serve as clerk, and generally it's up to the clerk to be the person who scans through the correspondence to see whether there's anything that's worthy of bringing it to the attention of the entire board. And then the third person is considered a member. So, does anybody want to volunteer to do anything or to make a nomination for anybody?
I would nominate you to remain as chair of the Board of Health.
I second that nomination.
Okay.
I'm more than happy to be clerk. That was my role previously. I'm more than happy to be clerk. I can always set up some time to swing by to review stuff.
And I am happy to remain the member.
Oh, but we'll find some really good stuff for the member to do, you know, in terms of serving in lots of other boards. So, or committees.
B1 zoning.
I'm on the B1, yes, on the B1 committee.
Lucky you.
Yes. Luckily, my internet dropped out right at the end last time.
Sure it did.
Sometimes you just get lucky, you know. Well, I tell you what, I'm perfectly happy to run as chair, although I was preparing, in fact, to bring this item up as maybe for reconsideration, only because as of yesterday, I thought I was not going to be around for most of the fall. In fact, for about 4.5 months. I thought I had a teaching gig going in London.
Ooh.
However, some changes in the way the folks in the UK are making it clear they're not that happy with Americans visiting, including in our case about 400 or 500 students from Northeastern.
Oh,
And
wow.
me. essentially Northeastern pulled the plug on the program. So
Oh, that's too bad.
I'm not going, and neither are the students. And so the result of that is I will be around. So I would be happy to serve as chair for a bit longer, if that is the decision of the board. Sounds like it might be. And I'm very happy if Cheryl is willing to take up the gauntlet of being the clerk again. So is there a motion to approve that combination of officers on the board?
I move to accept Tom Gilbert as Board of Health Chair, Cheryl Dunnington as clerk, and Eileen Siegel as member of the Board of Health.
I second the motion.
Having been made and seconded, and I'm assuming very little more discussion is needed, is there a vote to approve that slate of candidates? All in
Aye.
favor, say aye.
Aye.
Aye. All right, motion is carried. Thank you all.
Yay.
And then we have a bunch of agents to appoint. These include, for the purposes of our traditionally important role of being concerned about wastewater management and so on, Wade Saucier and Tom Houston as Board of Health agents. Let's just go through the entire list. And Betsy, of course, is our executive assistant, is also an agent of the board. Carol Green, the town clerk, is an agent when it comes to the task of issuing burial permits. Mark Oram, whose contract we have before us for consideration as the sanitarian for restaurant inspections and housing code inspections. Hillary Cohen is the animal advisory agent. Ed Nolan is the emergency preparedness agent. Now, this past year, I believe we voted in that all of the Norfolk Police Department were going to be agents of the Board of Health when it came to the issue of enforcing our emergency code on, well, I think we called it face mask or facial coverage.
Yeah, and of course.
Something to that effect.
Yeah.
In other words, to support us in the mission that we have to try to enforce both the state and the local orders that deal with essentially protecting people from each other and keeping them healthy and not catching the coronavirus. So we should add that to our list of agents. Are there any questions or concerns about any of those nominees that I just read off?
No.
Not at all.
All right. Is there a motion to approve the entire list as read?
I
make-
move.
Oh, go ahead.
I was motioning everything today.
Mm.
I move to approve the list of agent appointments.
Is there a second?
I second.
All in favor, please say aye.
Aye.
Aye. All right, the appointments have been made. We have a contract from Mark, which should look familiar, Cheryl, because it hasn't changed in decades.
I know. I was feeling like kind of like what's the TV show Groundhog Day. So
Right. Essentially, the same tasks there that have been there for a long time. One question I had as I was reading through it, though, is that as we march along through the sort of reopening of the Commonwealth of Massachusetts, there are various phases and various stages where we end up essentially as a Board of Health being asked to at least be part of the conversation around how a particular entity is going to reopen, whether it's a restaurant, might it be a summer camp, might it in fact in the fall be the Norfolk Public Schools.
Mhm.
So for smaller operations like restaurants, I wonder whether we might want to ask of Mark whether he would be able to, within the constraints of how much money we have to pay him,
Yep.
be able to advise the board on things that we should be looking for when it comes to the reopening plans that these various organizations are responsible for developing.
Yeah. So Mark actually has been involved. So he did review the Eagle Brook, their outdoor dining plan. He's had conversations with Novatos, who had questions regarding their barriers between their tables. So,
Mhm.
and Mark was actually in town this past weekend doing inspections.
Oh,
So,
all right.
he has been involved, and I did ask him he stopped by on Thursday and picked up some of our mask signage
Yep.
that we had developed. So I printed him some up and asked him just to check when he was going around to make sure that all the businesses had those signs posted for us. So he did do that, and I told him about a couple of the complaints about the masks.
Mhm.
So he did follow up with that. So I think he had some conversations with the Dunkin' Donuts employees.
Mhm.
So I'm hearing from the grapevine. So
All right. Did he actually visit on this trip all of the food establishments or some of them?
he did get to some of them. I'm not sure which ones he got to and which ones he hasn't
All right.
yet.
Okay.
If he hasn't been to them, he'll be going to them soon.
All right. So he's already doing it. I think it might make sense, even though this particular contract has been photocopied, I don't know how many times. If we can somehow make a note somewhere that we would very much appreciate his continuing to serve in this capacity of being a reviewer of the reopening plans for food service establishments, especially since that's really in his wheelhouse. I think the board would be most gratified if he could do it. So could you get back to him with that request?
Of course.
All right. So with that change to come, we often don't get around to voting on these contracts for sometimes months after they start. So I don't really have an issue, I think, with maybe postponing this and seeing if it's okay with Mark, or just assume it's okay with Mark and go ahead and approve the contract on the assumption that that addition will be made. I'm not worried about there being a problem with doing that, given our long history with that particular person. So other folks on the board, what do you think? Do you want to make an assumption here we can vote pending addition of that one item?
I
That's
think
fine.
so. Yes.
Well, in that case, shall we go ahead and do so? All those in favor with that amendment, please say aye.
Aye.
Opposed? All right, we'll proceed. Now, actually related to that, I did a little bit of playing Mark Oram on Saturday afternoon. I went over to a small restaurant on 1A and 115 on the 115 side called Aroma, mostly takeout, but and there had been a concern expressed by at least one customer about people not wearing their masks. When I was there, everybody was, with the exception of one person who was on the telephone and had it slooped down to his neck so he could be heard over the phone. So at least on that day, everybody was doing what they were supposed to be doing in terms of facial covering. And the fact that a person from the Board of Health showed up to ask about it, I think, may inspire more routine adherence to the regulation. And oh, by the way, one of our signs was on the outside of
Good.
the front door. So yeah, they're aware
Mhm.
of our desire for them to do what's right. So that's my report on that one site inspection.
Excellent.
All right then, next item on our agenda is the fall flu clinic. So Betsy, would you like to catch us up on where we stand?
Sure. I don't have much for you yet. I'm going to reach out to Walgreens this week, see if we can coordinate with them to come up with a date in early October. Alyssa and I have been talking about the possibility of running a drive-through clinic. I'm not sure on the logistics if we could actually pull that off or not, but we're certainly going to try. So she did order state supplied vaccine, which is for, I think it was for kids under 18.
Right.
So we'll see how many doses of that we get. That was probably the gist of it for now.
Okay. Well, we'll have another report next month to see.
Yeah, when we have a little more,
how this-
when we have some details nailed down. So we'll continue. We'll be continuing to work on that.
Okay. Next item was I was going to be talking about what the reasons why I wasn't going to be around for the rest of the year. If we can forget that conversation, I will be around. The VNA contract. Did you send us a VNA contract?
I did.
Did they make the corrections?
I did. Yes.
Okay.
Yep. Hold on. Give me a sec. I'll actually pull it up.
Okay.
I have it here. So we made just the original version that they had sent, they had used a template from Medfield.
Oh yeah, that's right. So
Yeah.
fix that.
So I think I believe all those changes have been made.
I know Cheryl looked at this because you had that Medfield mistake fixed.
Yeah.
Anything else in there, Cheryl, that you saw that you wanted to bring up?
No, it was mainly that it had Medfield in half of the places. So, and it looks like it's the same contract that it's been since it was just the Walpole VNA.
Yeah, it hasn't actually changed.
Yeah.
Our nurse Alyssa has been doing a great job, Cheryl. I know you're kind of coming a few months into the whole COVID thing, but they've been doing all the case, follow up and case tracing for us. And he provides us with, and you probably noticed our case count twice a week, Mondays and Thursdays, which is posted on the town website.
Last time I checked, I think we were at 29, was it, total cases? And only a handful actually were active at this point.
Yeah, I think currently we've got 2 active cases.
2 active. Yeah. I know when they published the entire state listing, it does seem as if, for whatever blessed reason, Norfolk has one of the lowest per capita infection rates in the Commonwealth. I don't quite understand why we are doing so well, but we are at the bottom. I mean, there's some that are 0. Little bitty towns in Western Massachusetts where nobody's got the virus.
Right.
For the somewhat larger populations, our per 100,000 rate, I think it's what they use, is really, really much, much lower than any other town around us. And I don't fully understand it, except maybe a piece of it is we don't have any nursing homes and we don't
Correct.
have any other facilities.
That's one of the big pieces.
Yeah.
So if you pull the nursing home stats out, Rentham and Franklin have rates almost as low as ours. But
Okay.
basically it's because they have nursing homes. And I think the last count, 65% of the COVID cases were from the nursing home population.
All right.
I was thinking maybe because we don't have a high number of restaurants or bars as well in town. So that might have been, but I can see where the nursing home
Yeah.
statistic is quite significant.
Yeah, it's primarily the nursing homes.
Or maybe the folks that go to our bars in town, or well, let's see. I'm trying to think how the Eagle Brook even works these days, since the bar itself isn't even open.
Nope.
But maybe they're just better behaved than some other places. Who knows? Bottom line is we are doing extremely well. I wish the rest of the country or even the state were doing as well. Anyway, so is there a motion to approve this contract as it's been revised?
I make a motion to approve the Walpole Natick visiting nurse contract as revised.
I second the motion.
All in favor, please say aye.
Aye.
Motion carries. Okay. What is next for us?
Let's go back.
So
We skipped over the Board of Health representative to the B1 zoning working committee.
oh,
think
okay.
I think Eileen was very excited about.
Yeah, I know how much she was looking forward to being a part of that committee still. In fact,
Yep.
almost practically volunteered as we were speaking about the other assignments. So may we just say thank you very much, Eileen, for continuing your.
You are very welcome. It is an interesting and challenging committee. A lot of interesting discussion.
Well, you learn a lot about the way the town and the townspeople operate
Yes, that
by
is
being on a
correct.
committee like that.
You know so much about the town center.
Yes, more than I ever really wanted to know about the town center. But no, it actually is very interesting. And I know Rich McCarthy's awesome, and Erin and Josh, and everybody has really worked so hard in trying to move this along and figure out what's the best for the town. So it's a good committee, a lot of interesting people and contributors.
Well, glad you're enjoying your work and happy to see you continue. So thank you, Eileen. All right, what does that bring us to?
Somebody want to make a motion just to appoint Eileen?
I'll make this official. All right.
Thank you.
Cheryl, would you like to make a motion?
I make the motion to appoint Eileen to be the representative to the B1 zoning working committee for the Board of Health.
I'll second that motion. All in favor, please say aye.
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 Even if I said no, I would be outvoted.
We're outvoted. All right, so in terms of COVID-19 updates, Betsy, do you have anything to begin the conversation with?
Well, we've kind of already been talking about it. So we've talked about some of the opening of the restaurants, which we've been pretty successful at.
We've been involved in actually advising restaurant openers or restaurant operators. Certainly, you mentioned the Eagle Brook last time, and since then you've been involved with Novatos.
Novatos, Horse and Carriage. Horse and Carriage opened last Thursday. They've done a fantastic job with their setting up their dining rooms. So I think everybody's doing a great job.
Now, I understand that Novatos is also interested in being a purveyor of fresh seafood and meat. Does that require a change in their
really. We'll just, when they get to the point, Mark will inspect and just to make sure, he'll check their equipment because I'm sure that they'll have a refrigerated meat case and
Right.
so he'll inspect their equipment.
Okay. So basically it's covered under their current.
Yeah, it'll be covered under their current permit.
All right.
So pretty exciting. You'll be able to get fresh seafood and
Yeah. That could be
Are
a
we
steady
getting
customer.
any updates from the schools or sports activities?
I know Alyssa actually is working with the school superintendent.
Mhm.
So she has been working with them
Great.
on that. So
Okay.
not exactly sure what their plan is for the fall. So I really haven't been involved per se, but I know other town officials are.
So it
One
would
of the
just be
things,
the K through 6 that we're dealing with specifically as Norfolk versus the junior high and the high school.
that's a
So
good point. Is she working with the middle school too?
that I don't know. I don't know.
We should probably sort that out. If somebody is going to be basically coordinating with King Philip, are they going to do both the high school and the middle school?
Mhm.
We need to get that figured out.
Right.
And what are the other towns doing? Because everybody goes up to King Philip. So what's Rentham and Plainville doing for their elementary school also?
Well, right. In fact, I'm kind of wondering, since I think those superintendents do tend to coordinate a lot of what they do. It'd be interesting to know if they're all basically looking at the same
Mhm.
plan for school opening.
Yeah.
Um,
Imagine they're having plenty of meetings on it.
Mhm.
Well, it'd be interesting to see, what sort of issues they're confronting, and maybe Alyssa could be our contact
Sure.
and let us know whether they,
We can get maybe
in
an
fact,
update.
even like to meet with the board for that matter. If they are of a mind to, we could certainly arrange to do that.
Okay. We can certainly do that. The only other, I know, had a phone call from left a voicemail, Run and Gun yesterday. I guess the governor's phase 3 opening started, what was that, the 13th?
Mhm.
So he's reopening and holding his lessons and things, whatever they do at the ranch. So
Okay. Did I mention in our last meeting that I had a chat with him about there were concerns from the neighborhood about people exercising due diligence, as in
Mhm.
facial coverings or distance. It was
Mhm.
more an issue of distancing, which when you got a corral as big as the ones that they have, generally isn't a problem. But anyway, I think a part of this is something that Cheryl doesn't know about, but we had an issue in the board where there was a perception that they were staging an event over a couple of weekends, which seemed way beyond giving out writing lessons.
Mhm.
And in fact, the conversation that I had with the owner there suggested, yeah, really, it was way beyond. There was actually some events where they brought in a instructor from Texas, I think it was, who does this for a living, and he basically was giving sort of advanced training lessons to people who are involved in competitive horse riding.
Mhm.
And so it was a very, very different thing than learning how to ride a horse.
Okay.
Anyway, they had a grand total of about 10 or 11 people, including the instructors there. And I think we ended up by simply saying, all right, well, just be careful and also follow the rules that we've established in terms of maintaining separation and so on. And the two that were on the board to happen this year have already happened.
Mhm.
So now what's going to happen, of course, is now we're into phase 3. I think that was a phase 2 operation.
Mhm.
yeah,
And now we're in phase 3. Betsy, it might be worth another phone call if you don't mind making it to just let them know that they do need to come up with a plan, something which says how are they meeting the rules and regs that deal with phase 3 now.
Okay.
It's not a complicated thing to put together. It's one of those 1 and 2 page documents that simply
Right.
say,
I
hey,
think
look,
we gave them the template for
right,
it.
right, yeah. So they just got to
Okay.
let us know what their plans are. Or not even that, they just have to have a record there so that if anybody asks, they can see it.
Yeah.
Okay, if you would take care of that, that'd be
I
appreciated.
will. Absolutely.
After that, when shall we meet next?
I think I just had a couple more questions in terms of, so we
Go ahead.
addressed the schools and the restaurants. Who's in charge of all kind of the sports programs and things like that in town in terms of how those are restarting?
Well, anything that has any recreational camp for children. So I've gotten 2 applications, one for, actually, I'm not sure. One's definitely a soccer camp.
Mhm.
And then another one. So they both have to apply. And all that information is reviewed by Mark Oram.
Okay,
So-
and even just some of the, not necessarily camps, but just the leagues or the teams, is that again done through the school system or are those separate? So the soccer or the softball or?
Yeah, that I don't know the answer to that question. So we're not really involved in that.
Has there been any request for, permits? I mean, normally, this time of the year, of course, the Little League would be going full strength down at the fields, and that's not happening.
No, they normally get a food permit for their concession stand, so they
Right.
did not this year.
And same thing for Pop Warner in the fall. Now, I'm not even sure if Norfolk has a Pop Warner team anymore. Did you get one last year? Do you remember for Pop Warner?
I don't believe so.
Yeah, I think the number of Pop Warner teams is getting smaller and smaller in this region.
Yeah.
What about soccer? Do they use I know I always see them on the fields. Do they have to make arrangements with the recreation department to use the fields or?
Yeah, that's done through the recreation department, I believe.
Okay. Maybe we reach
Right.
out to them to make sure, see what the plans are and if they've gotten anything from the soccer groups, because I know anything that's somewhat high contact to the state saying that, we shouldn't really be doing it. It's more of the distant type of activities that you can play.
Yeah, well, exactly. I know there were some places this summer that were running instructional leagues,
Mm-hmm.
but they really weren't playing the sports. They
Right.
were more like going through drills where the
Mm-hmm.
players were far enough apart so as not to, be within 6 feet of each other under most conditions.
Right.
So, yeah, it would be useful. Could you check with the rec department, Betsy, and just see if the Lions Club, for example, is even contemplating fall soccer?
Sure.
I know the school-based sports
Mm-hmm.
are not going to start now, even their practices.
Mm-hmm.
They're putting things off until sometime in the middle of September, I believe.
Yeah, I think it's September 14th.
Yeah.
So,
Tom, Donna Jones has her hand raised.
yes, Donna?
Hello.
Hi, Donna.
I was wondering about the Council on Aging in the library. If the Board of Health's involved there at all.
Oh,
And I did see a baseball game. It seemed like 2 teams on the field at Pond Street this weekend.
oh, really? Okay. Well, I think the recreation department needs to be consulted then to find out just what leagues or what teams are actually engaged. I mean, as I kind of think about these sports, certainly soccer and football come to mind. I guess baseball or basketball certainly qualifies too as being the kinds where there is intimate contact. Baseball with a little bit of design work, you can probably stay a little further away under most conditions, with maybe some rule changes. But anyway, yeah, we should find out what are the youth leagues or youth teams that are active in town right now. The rec department would be the best people to find that from. So why don't we do some searching right now to see what's going on, and maybe the rec director knows just what kinds of safety measures are already in place, because right now anyway, the Board of Health is not in the loop, and we should be.
And looking at the library is still closed, but they'll do things by appointment.
Yeah, the same as the town hall.
And as far as the senior center goes, Donna, is that still closed?
Yes.
Okay.
I thought they just opened up. Like they'll run a program, you have to sign up for it.
Oh, so it opens under special events sort of circumstances?
It says I just popped it up on the website. Norfolk Senior Center building will reopen on a limited basis to the public Monday, July 13th. There'll be restrictions in place limiting programs, classes, and class size. Social distancing must be maintained, and you must wear a mask coming into the building. So it looks like they're limiting what they're doing and basically having people sign up for it, so they can limit the number of people in their programs. But maybe we should reach out to them too to make sure that what they're doing is appropriate with the state guidelines.
And does the library have any anticipated date for reopening or under?
Not on the website.
Well, let's reach out. Does the Council on Aging actually run the senior center?
That's what it looks like.
Yes. Yeah.
Okay.
Yeah.
Let's reach out to those folks and just find out if you know, what their methods are, what their procedures are. They've set up to, you know, basically protect a very you know, sensitive population for us. And similarly, if we can get a hold of somebody in the library, find out what their plans are. What other groups come to mind, folks, that we should be thinking of?
I think Stony Brook, but I think that they'd already talked about reopening. I think they were all set.
I know they were very worried about being able to deal with large crowds. Do you know if they've actually opened? Is Stony Brook open?
They've put signs in the parking lot that said if you don't have a parking space, please come back. They've got cones in half the parking slots. Some people, 4 cars will park parallel on the street.
Yeah.
Did take your advice to put up a sign that said walk in one direction in the circle.
Good.
We've got it posted. Please wear a mask, and there's signs on the picnic tables. Don't use these, or the benches.
Yeah, it has that it's the boardwalk is open to local visitors. Buildings and restrooms are closed. And they have a whole set of guidelines for COVID-19. Oops, sorry about that. That was on the Stony Brook website. Sorry, I didn't mean to play any music.
Oh,
That's nice.
okay. Well, Well, the town is opening up, wouldn't you
Yeah.
know?
Well, everything's slowly opening up.
I actually do have an email here from Libby O'Neill. She's the library director. They were hoping to open the building up for computer use 1-hour sessions on August 10th.
Mhm.
She was looking to see if they needed to have bathrooms available. So, yeah, all right, I'll get a copy of everybody's plans.
Okay,
Send them
thanks,
along.
Betsy.
Can I?
And-
Related issue?
I'm sorry. Go
Donna?
ahead, Donna.
Places like Dunkin' Donuts still have their bathrooms roped off.
Mhm.
Is that because they're not willing to clean it frequently? And like the tables are blocked off, the bathroom's not available.
So they're basically takeout only.
Only.
And if it's takeout only, then presumably there shouldn't be any public restrooms available. And no interior dining. So they haven't requested any, inside dining at all. So as long as it's takeout only, then the bathroom should be closed.
Mhm.
The public rooms, anyway.
Did we get any feedback on some of the recommendations we had made for people who were uncomfortable wearing masks due to some underlying health concerns? We had suggested maybe the face shields. Did we ever get any feedback from them on that? Or did we ever give that information to them?
Well, we talked about it, I think, among ourselves without really taking any action. So actually, that's a question I guess I should really be asking Eileen and Cheryl. I mean, you folks are the medical people here. I think of a shield as being something you wear in addition to a mask to just protect your eyes and do some additional buffering. But at the same time, I know that in some colleges and universities, what they're talking about for the fall is having students wear masks, but allowing the instructor in the front of the classroom to wear a shield, because that way they can see your lips moving, so they can do some, interpretation that way. But at the same time, you can actually be heard. If you try to lecture for 65 minutes, as we do at Northeastern, or 100 minutes, you're going to fill up a mask with all kinds of liquid debris. And so there's just no way you can function, I don't think, as a teacher. So they're looking at using face shields for the folks doing that kind of work. But other than that, I have a sense that the shields are just not, that great at intercepting small particles floating through the air.
Correct. So I did a little research, and I actually happened to also have a dinner, appropriately socially distanced dinner with my friend and her husband. And her husband happens to be a physician board certified in internal medicine, critical care, and pulmonology. So I asked Bill, and I said, well, I'm going to be going to the Board of Health meeting. The question about asthmatics and masks. And, his comment was basically the same as what the World Health Organization and the CDC says. Find a face covering that's comfortable. Now, if an asthmatic may have a hard time with an N95, but nobody outside of a healthcare institution should be wearing N95s. So the people in the intensive care unit are taking care of the COVID-19 patients on the floor should be wearing the N95.
Right.
He gave me all sorts of information regarding pulmonary function tests and at what level people shouldn't wear a mask because they don't have enough ability to breathe in. He goes, technically, if you want to be a real stickler, you could require people who are saying that they can't wear a mask because of their asthma to produce a pulmonary function test signed by their pulmonologist stating that they can't do it. He said, but most of the time, most people should be able to wear, one of the surgical masks are very easy to wear. you know, I think as with the World Health Organization, the CDC, and also with my friend, you know, if you're that bad of wearing a mask, that your asthma is that bad or your COPD is that bad, you know, you shouldn't be in public because you're at a higher risk. So, you know, and then you get the people saying, well, it's only a 1% mortality rate. What's the big deal? Well, the big deal is that if you end up in an intensive care unit, what they're seeing in a lot of studies that the mortality rate is if you end up being intubated in an intensive care unit is about 80%.
Mhm.
So, and you know, you take two people of the same age, one has no comorbidities and gets COVID, you know, they feel miserable, they're at home for a couple weeks. You get somebody who has asthma, diabetic, hypertension, they're the ones that are more likely to have, you know, a bad outcome. And even if they don't die, what we're seeing is a lot of cardiovascular, a lot of issues with their heart. So they're having a lot of problems with their heart. COVID actually affects the vasculature system. So they're having a lot of clotting. So a lot of these patients are having pulmonary emboli, they're having clots to their feet, the whole 9 yards. So, you know, whereas a face mask, you know, you can wear the face mask. And if you look at CDC and World Health, yeah, you can wear it, but it still doesn't protect you from anything. The other thing with face masks is that you have to make sure you clean them and you clean them appropriately. So you have to take them off, you have to sanitize them. If you don't use the correct sanitizing agent, you'll fog up the face mask and nobody will be able to see you anyways.
Oh, I mean, you mean shield now? You're
The
talking about
shield, yeah, the shield.
yeah.
Sorry, the shield. There are face masks out there. I know the Partners is using it, or Mass General Brigham as they're called now, that actually have a piece in the center so you can see somebody's lips moving.
Right.
I never realized how much I read lips with everybody with masks on. It's very interesting as I get older. So, you know, my own personal opinion is, you know, especially as a healthcare worker, you know, I get in my car, I drive to work, I put my face mask on, I walk into the hospital. You know, my role is that I have an office by myself, I take my face mask off. If I go to the ladies' room, I put my face mask on. If I walk out of my office, if I go to the cafeteria, if I do rounds on the floors, I wear a face mask. If somebody walks into my office, if they're closer to me than 6 feet, I put my face mask on and I expect them to put it on.
Mhm.
You know, I think it's a function of, and the whole idea of the face mask, it's not so much of the face mask protecting me, it's me protecting you. So as I'm spewing stuff, the face mask is going to prevent that, those particles from coming out. That's really what it's all about. I mean, yes, you cannot have a face mask. I will decrease my chances, but what really is that it's decreasing your chances if I'm wearing the face mask. You know, you could recommend to these people that they wear the face shield. It's not as effective, but I really think the people who literally have you know, have their face mask like this, it's not effective either. And you know, if every business has on that you have to wear a face mask, and the people who are coming into that business are expected to wear a face mask, I think the people who are in the business should be expected to wear the face mask properly, unless they have a doctor's note saying that they can't. My own opinion, again, I'm saying this, my own opinion is I'm not going to go into a place that somebody's not wearing their face mask properly. I've been into a couple different places locally, not only in Norfolk, but other areas. And I've very nicely said, hi, I'm a nurse, you know, explain why you should be wearing your face mask. You know, I get kind of the puppy look at sometimes, you're like, what are you talking about, woman? And then I got somebody saying that, you know, this is why he's not, you know, going to wear the face mask. And my decision is I'm not going to go to those places. So, you know, I don't feel comfortable. I feel as though they're disrespecting me as a fellow human. So I'm not going to go in there. I'm not going to spend my money in there. You know, I think if somebody comes into a store not wearing a face mask and you call, you know, you tell them to wear it and you get all this hoo-ha and everyone's getting all crazy about it, then you know, you utilize the town, the police. But again, I think it's common sense to wear a face mask. And if you can't wear one, you're putting yourself at higher risk if you're saying that you have some type of pulmonary status. So,
Mark, you joined us at just the right time.
I think you raise such an excellent point that if people really have the kind of pulmonary dysfunction
right,
that makes it impossible for them to wear a mask. What in the world are they doing walking around in a public area, especially a crowded public area,
Mhm.
in the middle of a pandemic? Doesn't
Right.
make sense. There's a disconnect there.
Right, and CDC and World Health basically state it has to be some type of a face covering. So, every place is selling them. I have a really cool face covering that, when I don't feel like wearing a surgical mask, that I bought at the Big Y. Every grocery store has face masks, they're selling them. Every place has face masks. You can get, basically it's now become like the new fashion statement. So I really have a hard time on, if you have that severe of pulmonary issue and your pulmonary disease is that severe, I would think that you would not want to be around people who could potentially infect you and give you COVID-19 or the flu or whatever else viral thing, and you're more likely to have a bad outcome. But
Okay. All right. Do we have any other COVID-19 related perspectives?
We have Mark Orams on with us if you have any questions for him.
Ah, Mark.
Mark, you're on mute.
Okay, there we go. I'm sorry. Still having my Zoom lessons, I guess. Good evening, everyone. Mark Oram. I'm your health agent for food inspections and general sanitation. And thank you for having me here. I had a very busy schedule tonight, but I'm glad I could join before you ended. I did get out and make sure that, except for the 3 restaurants, make sure our other food vendors had the signage up for the front doors on facial coverings. And I did hear that end of the year discussion just a minute ago. And I agree, there's no reason why people shouldn't be able to put on some type of a facial covering. So, but some were in compliance, others weren't. And when I was near a small grocery store, I provided the same poster to a care. So wherever I could find the need. Fortunately, I didn't realize that Bork's closed as well as Richdale's. So found that in my tour, handing out some. So,
I didn't realize Richdale's is closed.
yeah, I apologize. I was going to give you send email on these updates as well. But yeah, Richdale's is closed as well as Bork's. But they were other stores. All our food operators outside of the 3 restaurants were provided. We'll want to get to our restaurants to make sure they're following the appropriate outdoor seating, indoor seating requirements. But as Betsy had noted to me, they're spending many resources to make sure it works.
We were talking about your contract a few minutes ago and noting that life is not quite as simple as it was maybe when that contract was originally written. And certainly that is the case when it comes to COVID-19 and the needs that we have of a person like you to be having the conversations apparently you have been having with people who are reopening businesses, food service establishments particularly, to take a look at what their plans are and to give them some advice in terms of the reopening process. Is that something that you're comfortable with our sort of sliding into the contract that we have with you so that you can provide those services to us?
By all means, and the contract's open-ended so that you can request that. Have no problem. I already started helping out Novatos, called for some information on the height of the plexiglass at booths and so forth. Betsy and I for a little bit about it. So I'm more than open with.
Good. Glad to hear it. Do you have any questions for us?
No, I'm sorry again, I arrived late, but anytime, Betsy's been excellent to work with too. I just want to thank her for being such a great administrator. It helps me out to make sure the work can get done appropriately.
Well, thank you for everything that you do to make my job a little easier too. So I appreciate it.
Glad to help.
Well, we've already essentially approved your contract with the slight extension. So we look forward to having you around town.
Thank you very much.
All
Long
right.
time. I want to go back in years, but we've had this going on for a few years now. So I appreciate it. I enjoy working in Norfolk.
Well, we're appreciating your work. I was thinking that when you first got on board, I think Bill Domi was still our engineer. And so may you continue in that tradition.
Work with Betsy's mom. Janet was there before Betsy when I started.
Yeah.
So, 2
Right.
years.
Yeah, I've been with the town since 1998, so it was before that.
Where'd those years go?
Well, anyway, Mark, welcome back aboard again. And if you have any, if you see anything that's really worth our bringing to our attention, please do so.
I will.
All right. All right. Good. Well, thanks for tuning in.
You're welcome.
All right. Other business.
Donna Jones has her hand raised.
Donna.
Hi, regarding Buckley and Mann. Not sure if Cheryl's somewhat up to date on it. The was a manufacturing plant on Bush Pond, and someone wanted to develop it into a 40B housing. Neighbors got upset. They, I forget what you call that. The public has a right to know of what's going on, and the DEP realized that the contamination wasn't cleaned up. So the developer that was going to do asked to put housing on the manufacturing side and the neighboring side, now is just going for the neighboring side. So one issue I'd like to follow up on is that prompted the neighbors to ask for signs that say about freshwater fishing at these ponds. So one question is, what's the status of the signs? And then off of that is there's a meeting coming up about that property on the 30th. And I didn't know if you knew about that notice that was issued by Rich.
Is that a ZBA meeting? What meeting is that?
No, it's just an informational potential developer meeting.
Oh,
It's on the town's webpage, front page. It's a feasibility team introduction.
This is the first time hearing of that.
July 30th, 7 p.m. on Zoom.
Well, the board should be represented. I'd be happy to be the representative if others are happy with that.
I'm okay with that.
Yeah, actually, that's a good point. As far as the signs are concerned, there is a new, really very colorful looking set of signs that have been prepared. This afternoon, I sent around, maybe you didn't see it, gang, an email that just had a suggestion that we might want to do a little tweaking with 2 out of the 3 signs so that the here's what you're supposed to do parts of those 3 signs are all the same. And so I can see that Cheryl knows what I'm talking about.
Yep, I saw that just before the meeting.
But essentially, I had the impression that everybody was pretty happy with the way the signs turned out. And so if you're equally happy with my attempt to make all the signs say the same thing in terms of thou shalt not do this, then let's go ahead and make those signs up. So for the folks down on Lawrence Street, the signs are practically up. Well, of course, they got to get printed first. So anyway, that part has been taken care of, and we'll be there on the 30th as well. So thank you, Donna, for bringing that to our attention.
I just emailed you the Zoom link to that meeting, Tom.
Thank you. Okay. Is there anything else, folks? Is there a motion? Wait, next meeting. Let's roll back up.
Oh,
Was
yeah.
it the 18th, 17th? When was it going to be?
I have a potential. When do I have it scheduled for? Let me find my agenda. August 18th.
18th. Yeah.
It's
Mhm.
typically the third Tuesday of the month. Unless we need to schedule it for some reason.
So how does that look, Eileen and Cheryl?
Fine with
Works for
me.
me. Yep.
Okay.
The only one we may need to potentially change is the November 17th meeting. That is a potential town meeting date, so,
Okay.
but we can reschedule if needed when it gets a little closer.
All right. But for right now, the immediate plan is to meet again on the 18th. And to be continued. So is there a motion to adjourn?
I move to adjourn the meeting.
Thank you, Eileen. For a second, Cheryl?
I second.
All those in favor, please say aye.
Aye.
Aye.